I want to present to you this morning Karen Dawson from Caresource. You should be able to see her presentation pulled up. So Karen, I'm going to go ahead and turn it over to you.
Well, thank you, Rachel. I appreciate it. And good morning, everyone. I'll just wave at everyone. How about that? My name is Karen Dawson. Just like Rachel said, I am a community marketing rep for Caresource in the Columbus area and also in your area and also in Circleville. So what I do is I don't sell anything. I educate and I market to, becoming members or members. I would like to be a resource for anyone who has questions. So you're more than welcome to give out my information at the end. I have my name and my email address and also my phone number. As we get started, this is the billboard that is displaying that we have all over Ohio. And it just says we are one. We are the #1 selected Medicaid plan in the state, and we are the largest Medicaid plan in the state by membership. Currently, like I said, we are the #1 Medicaid plan, but we serve over 1.2 million members in Medicaid. And we are where people live, work, play, and pray. Like I said, before COVID, normally I would do presentations or do events out in the community, and that allowed me to talk to our members and also people who just had questions regarding Medicaid and not sure exactly what to do, or even any of our products. So we're community-based, and I always look for partnerships that helps our partners, more than it helps us. I mean, basically, it has to be a win-win situation. So, like I said, I would like to be a resource for you if that ever comes up. Our mission statement is very simple. It's to make a lasting difference in our members' life by improving their health and well-being. We are a leading nonprofit health insurance located in Dayton, Ohio. I think we have 3 buildings now, which are probably pretty empty, but because we're all working from home. 30 years, actually 31 years, serving the low-income populations and also across multiple states with multiple insurance programs. Serving 2 million members in Georgia, Indiana, Kentucky, Ohio, and also West Virginia with our Medicaid marketplace and also our Medicare Advantage and our dual eligible. Keep in mind, all these products are available in your county, which is great. Our rewards program, we have 3 of them right now. Our Babies First is for pregnant moms. So if that mom signs up, she's on Caresource, and she signs up for Babies First in the beginning of her pregnancy, and she does the 1st, 5th, 12th, and that last appointment after she has the baby, she can actually earn up to $150, and then it transitions to the baby. Some of the things that they can buy is things that they'll need, toys, different items, healthcare items at different locations. And basically what they'll do, they'll call in and they will ask, to be in Babies First. They will get a packet. They will have information as far as what they can actually buy and where to go. Like I think it's Dollar General, Walmart's, CVS, Drug Mart, all those locations. But it's a nice reward program. Once the baby is getting, the shots and the checkups, monies goes on that card again. Kids First program. This is for kids from 18 months to 18 years old. Same scenario, but each kid in the household that is on Caresource, the mother needs to sign each of those children up, and each of those children will qualify to get monies on their card by doing dental appointments, health checkups, health screenings, and things like that. Keep in mind that none of these programs are available to foster children because there's money that comes to them from different entities. The Women's First program is for women from ages 19 to 64 that doesn't qualify for Marketplace or Medicare, and they're on Caresource Medicaid. Theirs is a little bit different. They earn points for doing, testings, dental appointments, also, I would say mammograms, pap tests, and they earn points to get gift cards to like TJ Maxx, Home Goods, Panera Bread, which is one of my favorites, and I can't have it, but that's okay. Different places that they can actually go to. And they'll get a packet the numbers. Each one of these programs will have a number so that our members can actually call in and check and see what's on their card so they'll know how much they can spend. And it gives them a variety of things that they can do as far as, where to go, all the items, because there's a lot of items that they can take advantage of. So, but there are programs to basically keep our members healthy. Applying for Medicaid, excuse me. This is one that right now, the open enrollment for Medicaid started November 1st and it goes through the 30th. As a new member, now keep in mind when I said open enrollment, that is for people who want to change to a different program. They can change between now and the end of November. If someone is applying for Medicaid for the first time, what happens if they get that letter of approval, or once they get that letter of approval, a plan has already been selected for them. Ohio Department of Medicaid automatically selects a plan for that person. Now, what they probably don't know is that they can actually change that selection within the first 90 days. So 90 days from that date of that letter, they can actually make a change, or they can stay where they want, where they were chosen for. Open enrollment, once again, is in November, and we're in it right now. And there's one more reason. If someone missed the open enrollment, they missed that 90 days, there is a program, or not a program, but what they call Just Cause. What that means is that they have a reason why they want to change. It has to be a good reason. They have to call that Medicaid hotline number that you see on the board and tell them the reason. It's a 50-50 chance, but if they have a good reason and they want to change and they're granted that opportunity, then they can change. Otherwise, they'll have to wait until that next open enrollment. Medicaid open enrollment November 1st to the 30th. The Medicaid hotline, that is very important because that's how they can change or either add or ask for that special just cause reason. They're open from Monday through Friday from 7 to 8 p.m. and also Saturday from 8 to 5. You can visit Caresource at caresource.com/Ohio Medicaid. Marketplace. This is real important at this time because I think everyone knows that we've had a lot of people that have been unemployed and they're not sure of what to do. So they're probably hitting their savings accounts, their 401ks, and kind of running out of money. So this marketplace is for people who do not qualify for Medicaid or Medicare. Open enrollment is now. It started November 1st. It goes through December the 15th, and I'll say that again. But in the marketplace, keep in mind, the marketplace allows, kids to be on their parents' policies until they're 26 as part of the Affordable Care Act. Also, pre-existing conditions is voted there. Seniors, preventative people who, like I said, do not qualify for Medicaid or Medicare to have insurance. So if you know of anyone, and I know you probably heard some people talk about not having insurance and not showing what to do, like I said, I can be a resource for you. Like I don't sell anything, I just market. There are several credits that they can take advantage of if they qualify. One is to help with premium. The other one is for co-insurance, co-payments, and also deductibles. I do have a number for that as well. There is your information regarding open enrollment. Here is the number for Marketplace as well. They're open from, and now once you call that number, you'll get a Caresource rep that is a licensed rep with the state, just like I am. They are open from 7 to 7 p.m. They can guide you through that process. I always tell people when they call me, once you go to the market or you call this number and that rep starts to help you, they have to transfer you to the marketplace. That rep, if you ask them, will stay on the line with you. They help you navigate through the process. So the help is always there. Medicare Advantage. I spent 10 years doing Medicare and decided that I wanted a little bit more and know a little and go where our younger crowd. So that's why I'm doing what I'm doing currently. But we do have a Medicare product that is in your location, which serves people that are disabled and qualify for Medicare by paying into Social Security for 10 years, or people that are 65 and older. who qualify for Medicare by, paying into Social Security for 10 years or 40 quarters. Our programs included, of course, the Part A and B and D, which is your A is your hospital, your B is your medical, and your D is your prescription drug coverage. And we have other coverages in there as well, as far as hearing, dental, and things like that. So the open enrollment for Medicare it started October the 15th to December the 7th. There's our number for if you want to call in. That number is open from 8 to 7 p.m. Monday through Friday. And here are all we have teenage kids during the summer, and you want to have them call in and work with them, they can actually do that. Keep in mind, if the parents are not on Caresource and the children in the household are, the parents can still take advantage of this program. And what it is, we know that it isn't easy for someone who has either lost a job or has not had a job or hasn't had a job in a very long time to transition. So the goal of this program is to help them reach their goals and their dreams by working with them. They actually did a life coach for 2 years because we know that they're going to transition through not having, a Medicaid or Marketplace, or they're going to make a little bit more money. There's a world of resources that they can tap into. It also helps them build a network and partnerships and support in finding full-time and part-time jobs if that's what they're looking for. If you notice here, I always point this out, this is 11,853 from all the counties that we work in with our community partners. There is a process where you can actually refer someone to Caresource if they have Caresource to work with Job Connect. As you see here, the 67% is a member who has retained employment through our Job Connect program, and it is in your area as well. We had over 3,000 people to opt into life services and more than 12,000 members who had interacted with life services. So also, I think employer partners. The employer partners, we have a person in Job Connect that works with employers to bring them on. And if a person wants to interview with one of those types of businesses, then they can do that. The life coach also helps them with, resume. And if they don't have their GED, can help them. We have resources for that as well. So it doesn't cost them anything. This program is for Caresource members. Like I said, if the kids are on Caresource in the household and the parents are not, the parents are also able to tap into this program as well. We start working with children at age 14, which is a good age. Any questions so far? And here's my information. So if you have questions, even after we end this call, you're more than welcome to reach out to me. I don't sell anything. I just educate and, give people the information that they need to be successful in retaining healthcare. Because we know right now, I didn't think about it for a minute there when people were getting laid off and the unemployment numbers were going up. And I said, wow, after a couple of weeks, I realized that those people probably do not know about the government-sponsored programs that are out there that could help them with health insurance. So I started making calls to businesses that could have or may have people that they well because they didn't know exactly where to send them to. If you have questions, don't hesitate. No question is, as people say, well, I'm gonna ask this crazy question. It's not that way. If you're not doing this every day, it's something that it changes a lot. I do certification every year. It takes me about 2 months to get it all done with everything that has to go on for all the products. But use me. That concludes my presentation. Do I have any questions?
I don't have any questions in the chat, but I was going to ask if you could send me your presentation. Can you email it to me?
Ask one question, don't you? Do you have it, Rachel? Can you? Yeah, I can. If you, yeah, we can get it out to you. That's no problem.
It's the same as the one you emailed me, right? I can just send it out that way.
Yes, it's the same.
Okay.
You know, and keep in mind, I'm available to do staff presentations. I'm available to, you know, I can do a virtual presentation for you for staff members or anybody who's looking forward to doing that or needs more information. I'm open for that. If you have you probably don't have groups of members coming in or people that you serve right now. But if you did and you needed to do a virtual presentation, I'm available for that as well.
Okay. Yeah. I'm going to send this out, your whole presentation out to the support coordinators in our office so that if they couldn't come today, they have that, and then the recording too. So yeah, they'll get that. Does anybody have any other questions for Karen?
I have a question.
Oh, good. Go ahead.
Sure.
So it's not directly related to what you were just talking about, but I know, hi Karen, it's Andrea from United Way. We received a grant from you.
Hi Andrea, how are you?
Good. And
yes, I think I came into your office.
You did. It was so nice. Yeah.
Yes.
So I know you're not doing grants right now. Do you know when grants will open back up again?
I wish I did. They haven't given us that information for that. I mean, being that you know, our foundation is to do some emergency things but here's the thing, once I do know, I can let you know for sure.
That would be lovely. I appreciate it.
Did you work with Kathy?
Yeah. She's not there anymore. Sorry?
Andrea?
I think it keeps going out. I don't know if it's my internet.
Karen, you're freezing up on me. I don't think it's your internet. It's happening.
Okay.
Are you still there? I can see your face, but I can't hear you.
Okay.
There you go.
Are you talking to me?
You're coming back, but it's a little glitchy.
Okay. Andrea, as soon as I know, I will let you.
Perfect.
Okay.
Thank you.
Okay, great. Any more questions?
I don't see any more. But like I said, I'm going to send out your PowerPoint and your information, and then you may have some people call in from our agency.
Okay, that is fine. I appreciate that. Well, that concludes my portion of it. Should I stop sharing now?
You can if you'd like.
Okay.
Okay, so coming up on Thursday on Virtual Community, Miranda Gray will be with us from New Horizons. And then next week, Fairfield Medical Center Foundation and also Harcum House will be Tuesday, Thursday. So we're looking forward to those. So appreciate everyone being here today. Thank you so much. I'll send the PowerPoint out. Karen, thank you for being here. Yeah.
Thank you for having me. I appreciate it.
No problem. All right, guys. That's all for today. Have a good one.
Thank you.
Thanks. Bye-bye.
Bye-bye.